Hey there, everyone. Thanks so much for joining me here on Wave Now. I'm Myra Ansari with Dr. Allison Black from Norton Children's Hospital. She's a cardiologist with Norton Children's. And today we are talking about congenital heart defects because February is Heart Month. So we want to bring awareness to why talking about this is so important. A lot of folks, Dr. Black, may not know what congenital heart defects are. Can you just kind of explain that to folks?
Sure. So first, February is a really exciting time to highlight our patients, specifically those with congenital heart defects. And so what those are is really a matter of the structure or the building blocks of the heart just don't form normally. And so unlike acquired heart disease, which is something that environmental factors really impact throughout someone's lifespan, congenital heart defects are defects that a baby or someone is born with.
You know, I'm a parent. You're a parent too. When you get that news that there's something wrong with your baby's heart, that has to be really scary for a lot of parents. Walk us through just kind of how Norton's we have this great facility in our backyard here, how you're able to help families when they get that scary news.
Sure. So as a fetal cardiologist, that's one of my favorite parts of my job, actually. And that's what we try to do is really walk through families through their congenital heart disease journey, so to speak. So from fetal up to adult congenital heart disease, we really want these families who get the diagnosis to be prepared, understand what that looks like for their child, because every child's really different in terms of the spectrum of congenital heart disease and what we might see. And so we really have a special team of people within our Heart Institute to help guide families and children through that diagnosis.
And how do you even know that there's something wrong with your baby's heart?
Sure. So that also varies for depending on the type of defect for how we find out that something might be wrong. And so what I tell people or couples who are thinking about getting pregnant is really making sure that they know their own health history, that they have a good relationship with their prenatal and primary care provider, because the first part of recognition and identification is that history component.
Okay.
And so there are certain congenital heart diseases like bicuspid aortic valve, for example, that run in families. And so that might be one reason that someone comes to get a fetal echo within our institution. And then there's other things such as genetic disorders like trisomy 21 or Down syndrome that have a higher risk of congenital heart disease that might link us to looking a little bit closer at someone's echo. And then also risk factors such as maternal diabetes.
And that's what you're looking at in this video right now, right? Is you're looking at an echo of the heart.
Yeah, so I'm an imager. So I both do, as I mentioned, fetal cardiology, where we look at the heart within a baby who's still inside of mom. And then we also can use that same ultrasound technology, which is what you're seeing on the video here, to look directly at the heart after children are delivered. So those that maybe aren't diagnosed fetally or have follow-up echoes, that would be the type of echo that we're looking at there.
All right. If you have a question for Dr. Black, please share it with us here on our social media pages, and we'll try to get it answered. Or if you have a child who was born with a congenital heart defect, please feel free to share your story with us. We hope that your little one is doing okay. What are the most common types of congenital heart defects? You touched on some of them.
Sure. So not to get too deep in the woods of an anatomy lesson, but the most common types, actually, the heart has 4 chambers. So there's 2 top chambers, the collecting chambers, and then the atrium, 2 bottom chambers. Those are the pumping chambers or the ventricles. And kind of like the septum or wall of the nose, the most common defect is what's called a ventricular septal defect, or a hole between the bottom 2 pumping chambers.
And if you're wondering how common this is, it's 1% of the population, which may not sound like a whole lot, but then when you hear the numbers, that's 40,000 births per year in the US. That is quite a bit.
Yeah, it's one of the more common birth defects that we see. And so that's why really our goal is to try to identify those that potentially would need to deliver close to a center like Norton that has a formal heart institute in terms of that planning, because that's the first step.
And is there a way to prevent this sort of thing?
So, unfortunately, there's no magic pill for congenital heart disease. And so, as I mentioned previously, I think the biggest thing is working with your primary care provider or your OB in terms of risk factors. Some of the things that can increase the risk of congenital heart disease is maternal diabetes, as well as I mentioned, family history. And so, those might be reasons that you get referred to a fetal cardiologist like myself. That doesn't always mean that we're going to see an issue, but what our goal is to really focus on that baby's heart.
Is that why I remember when I was pregnant, that they check for diabetes often? Is that why we do that as well?
So that's one of the reasons. And so in addition just to global OB care, again, I'm not an OB,
Sure.
But when we do see maternal diabetes, that is sometimes the reason that your OB or your MFM specialist might refer you to see myself or one of my partners.
So I was reading about this, Dr. Black, that people are living longer, right, in the U.S. with congenital heart defects, but there's still reason to be concerned because it can lead to problems.
Yeah. So this question is probably one of the most exciting, again, reasons to be a cardiologist. So congenital heart disease can be scary, but just the advancements in the field really have allowed us to create heart centers within the United States, including those, again, like the one at Norton Children's, where you really have specialized pediatric providers from fetal to our dedicated cardiac intensive care unit, which have nurses and attending providers who focus on kids with congenital heart disease, to that acute care unit, which is run by cardiologists, and then in the outpatient setting as well. Our surgeons have really done an amazing job in terms of thinking about surgical interventions for congenital heart disease. And we have dedicated anesthesiologists, which all have impacted our ability to talk about what does survival look like for these kids, and what does a life with congenital heart disease look like for these children. And I think that that's really what the focus is in terms of both you see Dr. El-Soufi and Dr. Kosick in that video, and they just are really remarkable in terms of their ability to intervene and operate on children with congenital heart disease from neonates to adults.
So, I think of heart surgery, and I think of something that my dad went through, just something, open heart surgery, but that's something that babies can have performed on them too, and it can help and change their lives.
Yeah, it can. And I think these little ones are troopers, right? If you or I had heart surgery, you're right, or your dad was maybe out for quite some time in terms of what that might look like. And so babies and little ones diagnosed with congenital heart disease, again, everyone's length of stay and the way that they respond to their operation or their congenital heart disease really can vary. But I feel lucky to take care of them every day. They're really troopers. And so those surgeries and operations really do save their lives and allow them to actually live with their disease and go through that heart journey.
So it's not necessarily always a fatal outcome. With the proper diagnosis, with catching it early on, there is a path forward.
Yes. And so again, the spectrum of congenital heart disease is really variable. We can see anything from little ones who have small holes within their heart that potentially doesn't even need an operation, right? So there are some congenital heart disease lesions that we kind of have to watch over time. And so working with providers to watch that more mild form in that situation is really important to those that maybe are the more complex single ventricle types of heart disease, which may need multiple operations and spend more time within the hospital. But certainly what our goal is for them to leave the hospital and really function to their full potential with congenital heart disease.
If you are born with a congenital heart defect, is this something that more than likely you're going to have to keep an eye on for the rest of your life? Or is it something that if you can get it addressed and have the proper procedure done, that things are okay?
So that's a complex question,
Yeah.
right? And so I think,
figured as
yeah,
much.
yeah. So I mean, it's a good one because that's what people think when they hear the words that you're going to see a fetal cardiologist, right? And so sometimes that waiting game and that time can really be variable in terms of what that might look like for your child and for your family. And I think that I guess the big thing is that we really take an individualized approach in terms of there are some defects that certainly don't need surgery or don't need intervention, and they follow with my partners in outpatient clinic and potentially get discharged. And there's others that are a little bit more complex in terms of that they may need more than one surgery, may need more than one catheter intervention, and may need lifelong follow-up in terms of living with that congenital heart disease.
Talk to me about signs and symptoms that parents should look out for. Is it something that you're going to know before you deliver your baby because you have the ultrasounds and whatnot, or is it something that you can find out after you've had your baby?
Sure. So prenatal diagnosis specifically for the more critical heart defects. So you mentioned about 1% of children can have a congenital heart disease. About 1 in 4 of that 1% actually need a surgical intervention or something for their congenital heart disease, the more critical forms. And those are really the ones that we're looking for fetally because they might require change in delivery location. So we really carefully plan where those babies are delivered. Now, within that 1%, all of these are screening tests. So there's certainly times that either it's more challenging to see that defect either by the OB or by the fetal echo. Sometimes babies inside, they just don't cooperate with their pictures, and that's okay.
Yeah.
And that's why we have pediatrician colleagues and neonatologists who look at the baby before they go home. And then within the state of Kentucky, we actually have a congenital heart screen. And the point of that screen, it's a painless test for the baby. So really, we look at the oxygen level in their upper extremity or their arm and in their legs to see if there's a difference. And that picks up an additional component of that congenital heart disease that potentially would need intervention. And then after they go home, we really rely on the pediatricians. Feeding is, I laugh a little as a mom, it can be different for all babies.
Oh, yeah.
But it is kind of a baby stress test. And so sometimes babies who really are struggling with feeding and not gaining weight, that might be one indication. Blueness on the extremities or around the mouth might be another indication. Sweating or breathing fast with feeds suggests that sometimes the baby is having a hard time and might be something a reason that your pediatrician refers. And then for older kids, really struggling with activity is the bigger kid stress test and might be another reason that your pediatrician refers.
All right. I want to give a shout out to Jennifer Hickey. She says, we love us some Dr. Black, our first cardiologist that we had when our son Thomas was born. So thank you for sharing that, Jennifer. And I hope that your son is doing much better. Dr. Black, any stories that just touched your heart overall in your career that you saw come in and where your patients are at now? I know that's a kind of dig into the memory book.
Yeah, I mean, the Hickeys are an easy family to think about that with. I think that congenital heart disease can be a lot to pick up and in terms of digesting the information and sharing it with your loved ones and kind of expecting the unexpected. And families like the Hickeys are really the reason that I do this. Their little one is adorable and, has certainly gone on his congenital heart disease journey as with many of my other patients too. And so I think just watching the families grow and see what their child's potential is. And then I also think about the loving side of medicine. And so a lot of these families spend not insignificant time within the walls of this hospital or that.
It becomes their second home in many ways, or their first home when they're dealing with it nonstop. It can be very frightening.
Yeah. And so, so sometimes trying to normalize what that looks like and watching families experience that side with their little one. And one way that we do that is through a program called the Heart of the Bookworm. And so that's a really neat opportunity where, when you take your little one home, bedtime story reading is part of the act, right?
Yeah.
Part of the routine. And so this is what I call the loving side of medicine. And so we're really lucky to have a support group like Bravehearts, which I appreciate you pulling up on the screen.
This is the website. For those of you that want to look it up later, I did put a link on this stream, so you can just click on it. It's nortonchildrenbravehearts.com. Dr. Black, what is this website?
Yeah, so this is one of the ways that our community can give back, and just to give a little bit of love out to our truly Braveheart community and the kids with congenital heart disease. You'll see a wish list. The first thing that pops up is deodorant, which seems a little funny, but you can imagine if your little one has either a surprising congenital heart disease diagnosis, those like small little pieces of love in terms of just those daily things you don't think about as much are really important. But also some of the books, the parents use these and actually put them up within the room, and it actually, no pun intended, really warms my heart. It makes it feel more like a space that a baby's in, right? And so there's a lot of IV pumps and other things that will be within that room, but every so often after rounds, I'll read Chicka Chicka Boom Boom to a little one. And it just reminds you that around that congenital heart disease diagnosis, there's actually a baby, right? And that's someone's baby.
Someone's baby. And I think, I'm sure for you, Dr. Black, but you've dealt with babies your whole life. But after becoming a parent, you always think, that could be my baby. I could be that parent. And it hits you in a different way. It does. So this is what you're seeing. We're not just shopping on Amazon. This is stuff that you can purchase, and it goes to a family who's dealing with this struggle right now, to give them a little comfort, to know that someone out there cares for them. And when they get that package or they get these items, I know that means the world to them, that someone out there is thinking of them. Have you seen it impact families?
I have. Like I mentioned, I think it's even just the small things within the room. I think that it can be a lot to spend first birthdays and first milestones within the hospital. And so I think just having those little things that remind you that this is still your child and a way to connect, and that people out there are thinking of you, right?
Absolutely.
Like there's a reality. And I think Louisville and Kentucky is a really special place, right? And people want to support each other. And I think that this is one way for children who are living with congenital heart disease and their family who's going through this journey with them can support them.
So when you go on the website that I just took you to, what you'll do is you'll just click on Amazon wish list. There's a link over here and it'll take you directly to it. Very easy to do. So Dr. Black, I appreciate your time today. We've got to get you on our noon show today as well. But is there anything that I did not ask you that you want folks to know out there? There are improvements that we have been making over the years. There are resources out there. If you think something's wrong, talk to your pediatrician for sure.
Yeah, talk to your pediatrician or your primary care provider or your OB. I tell people all the time I practice sleep medicine, not literally, but that means sleep for me and sleep for you, right? So if it's keeping either of us up at night, then that typically means that we need to talk about it. And so if there's a question or something that you're thinking about in terms of whether or not your child or your little one might be at risk for congenital heart disease, we have a team of people that can help look through that and investigate and really make that path a little bit more comforting in terms of if that's something that you're thinking about as you lay down to sleep.
Absolutely. Dr. Black, thank you for all that you do, helping our little ones and our families in our community. I'm Myra Ansari with Dr. Allison Black with Norton Children's. Have a wonderful day.